Hello, my name is Matthew Noonan. November is Men's Cancer Awareness Month. Last year I let you know how important that month is to me, since in 2015 I was diagnosed with an aggressive case of prostate cancer. This year, I've asked the two medical professionals who have treated me through my diagnosis to talk to you on the importance of annual physical exams, early detection, and preventative testing.
My name is Dr. Sheldon Pike. I've been practicing urology in the New York City area for 27 years. I graduated the Mount Sinai School of Medicine in Manhattan and went on to a surgical residency at Columbia Presbyterian Hospital. After that, I did a urological residency at Beth Israel Medical Center in Manhattan.
I was introduced to Dr. Pike after my physical exam had indicated that my prostate had some issues. Once we found out that I had an aggressive state of prostate cancer, Dr. Pike was instrumental in developing a plan that would A, keep my prostate, and B, have less side effects as possible.
Hello, Mr. Noonan.
Hello,
How are you
Dr. Pike.
today?
Very good, very good.
Any problems since the last time I saw you?
No, dropped some weight and everything's looking good.
I
So
noticed you're looking
I'm
good.
feeling pretty good. So I think everything's good.
Very nice.
After meeting Dr. Pike, I knew that I needed a medical professional for day-to-day questions and just to handle some of the issues that I might run up against in dealing with the diagnosis of cancer.
Here to see Dr. Savransky.
Okay, looking good.
Thank you. Looking forward to this blood work and getting it over with and seeing what the PSA is going to be.
I was introduced to Dr. Alexander Keratin. He was connected and a colleague of Dr. Pike's. I really liked Dr. Keratin's no-nonsense approach with me, sitting me down, telling me the things that we were going to do that were going to be outside the cancer, that were going to help me begin a really nice wellness program. Unfortunately, Dr. Keratin passed last year. I was then introduced to Dr. Keratin's sister, Dr. Savransky.
Dr. Sabansky will be with you shortly.
Okay.
Okay?
Thank you.
All right.
Matthew?
Hello, Dr. Savransky.
Hi.
Good to see you.
Come
Thank
on
you.
in.
I really liked that brother and sister dynamic between the two of them, and I could see the impact of Dr. Keratin's passing on Dr. Savransky. So I immediately gravitated to her and was really excited when she became my day-to-day medical practitioner.
My name is Dr. Savransky, and I received my medical education back in Ukraine. I graduated from Mount Sinai Medical School residency program in internal medicine. I also worked as the teaching attending in Cabrini Medical Center. Later, I opened my own practice where I reside now. My office is dedicated to primary care and internal medicine. I do initial interviews and medical examination, physical exams. I treat acute and chronic diseases. I also screen patients for many different types of diseases, depend on the interview and physical examination. And I do a lot of preventive medicine. So let's see your blood pressure, other vital signs. So I actually reviewed your blood test recently and everything looks fine.
Perfect.
But now you gained 10 pounds, so
Right.
we really need to work on it.
Okay.
Well, let's discuss what are cancers that are particular to men. That would be prostate cancer, penile cancer, and testicular cancer. First, just a note about penile cancer. It's extremely uncommon, and the only way it's diagnosed is on a proper physical examination. As far as testicular cancer goes, it's also not that common. However, it is common in age groups of men in their 20s and in their 50s. There are excellent treatments available for all types of testicular cancer, and the overall survival rate is well into the high 90s.
The most important is prostate cancer, and we have prostate-specific antigen, which is a very simple test to do. It should be done on patients who are symptomatic or patients over 50 and in certain ethnicity the incidence rate of prostate cancer is actually more in African Americans than in other population. And it's, I think, 2.5 times more than in any other ethnicity.
The PSA is an imperfect test. Not everybody with an elevated PSA needs to have a biopsy. I can tell you in my experience, I find it highly useful. Prior to the advent of PSA, there were a significant number of men that actually presented with metastatic disease, meaning the disease was not localized, that it had already started to spread. A much more difficult situation and much more difficult to treat. However, after the advent of PSA, most of the patients that we see presenting with prostate cancer these days have localized disease, which in many cases doesn't even require treatment. We can put the patient perhaps on a active surveillance protocol. The biggest change in radiation therapy over the last 30 years is the advent of high-dose radiation, which is given much more precisely. As far as surgery goes, the biggest change in surgery was the minimally invasive advent of robotic surgery, whereby instruments are placed inside the patient and the operator works at a panel through which he looks inside the body without opening up the body, and he can control the instruments in order to remove the prostate and reconstruct the urinary tract, thereby decreasing significantly the complication rate.
Let me just take a little listen here.
Okay.
Take a deep breath. Okay, let it out.
After a prostate needle biopsy, I always have the patient come back to the office 2 weeks after the biopsy. Once I receive the results, I never give the results over the phone. Whether it's good or bad, I believe that the patient will always have questions and will need to talk to me about what might be ongoing from that point. For instance, if the biopsy did not show cancer, the patient wants to know what caused this elevated PSA. What other problems do I have at the present time? How are we going to deal with this in the future? Are we going to repeat the PSA? Do I need another biopsy? And all these things have to be addressed, and they're better addressed face-to-face. If the patient does have cancer, I have a standard way that I approach this with the patient. I tell them, listen, there's good news and there's bad news. The bad news is you have cancer. The good news is there are treatments available, and I will be with you there every step of the way.
About the hormone therapy, the pills that I've been taking.
Yes.
Dr. Mark had said something about, we'll monitor, but maybe we could see I won't need to take them the whole year. Are we thinking the year?
I believe in general my plan was to go for 3 full years with you.
Okay.
And I think we've got about another year left.
Another year. I'm anxious to get off
Well, I'm
of
glad
them.
to see you've been taking care of yourself.
You really need to be positive about difficult diagnosis. And first of all, you need to get a lot of information about it, about disease, about how it proceeds, what to face, what to expect. American Cancer Society offers a lot of information about it. Bad diagnosis does not mean bad treatment or bad outcome. So the faster you get on treating these patients or getting involved with family who can also help and support, or other relatives or somebody or friends is very important. But also being very consistent and following directions of what doctors do. I'm gonna send the PSA results to
Dr. Pike.
Dr. Pike.
Okay.
And we'll see how it goes.
Excellent.
All
Excellent.
right.
Thank you. Thank you.
Welcome.
I'd like to thank Dr. Pike and Dr. Savransky for taking the time to talk with us today. Let's face it, the word cancer is scary. And when it's part of your diagnosis, there's an immediate reaction and impact. Today, I can say I'm cancer-free, and it's thanks to doctors like the two that cared for me. So if you are diagnosed with cancer, don't worry. There's other professionals out there that are going to make sure that you are well. So I hope you'll help me spread the word that the month of November is Men's Cancer Awareness Month and how important annual physical exams are for men's health and well-being. Let's keep fighting the fight. Take care.